Hello and welcome. I am Dr. Lara, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to Light Body Radio. I am your host, Dr. Lara, and in this week's Wellness Illuminated episode, we are going to dive deeper into interpreting your lab results and what to ask your provider. So whether you are looking for conventional or functional medicine lab tests, it's important to understand your results in helping you be informed and empowered and an active decision maker in your own healthcare journey. And so a lot of us are just told that our labs are quote unquote normal, even if they still don't feel well, and even when they're bringing symptoms to their provider. So oftentimes there's obviously more to the story that we're not getting to, or it's not being evaluated deep enough. So I wanted to break it down a little further for you this week. So the first aspect of this is, number one, just the basics, understanding your lab results. And for those of us out there, those of you that are not in, the healthcare realm, the medical world, there's, one big reason, and that's because the ranges vary between conventional and functional medicine. And conventional medicine typically uses what we call reference ranges, which are based on average population, the numbers of any person. If you sampled 100 people, just on average, those 100 people would fall in a certain range. And these ranges can help diagnose disease, but they might not reflect optimal health. But functional medicine, on the other hand, focuses on optimal ranges, aiming to identify imbalances before they develop into chronic disease. So this means we look at patterns and trends over time rather than just also a single test result. So what should you be asking and reviewing with your provider when you go over your lab work? And I want to take you through some of the key categories of testing and what to discuss with your provider. So this next section, we're going to dive a little bit deeper into some key lab markers and what questions to ask. The first thing I want to touch on is thyroid health, because so many of us out there do have some sort of thyroid imbalance, or we're symptomatic and our thyroid imbalance has not been diagnosed yet or been diagnosed properly. And so I thought this could be really helpful for a lot of people out there. So thyroid dysfunction is one of the most underdiagnosed conditions, often because only the TSH, the thyroid stimulating hormone, is tested. A full thyroid panel provides a more complete picture. So the key markers to test are, yes, we do need to know what your TSH number is. Again, that's thyroid stimulating hormone. That's what that stands for. It regulates the thyroid hormone production. And within the allopathic world, the normal range is considered 0.5 to 4.5. Which again, we talked about in the last episode, how wide of a range that is. And in functional medicine, it's much more narrow. It's 1 to 2.5 is the optimal range for optimal functioning thyroid. But we also want to look at the free T3 and the free T4. And this measures the active thyroid hormones. If T4 is normal, but T3 is low, your body may not be converting T4 efficiently. And we definitely want to make sure that in order for your thyroid to be converting everything appropriately, that you have enough of each one and that each one is being converted appropriately. So by looking at these different markers, then we get to figure out, okay, where is the breakdown actually happening? And then there's also the reverse T3. And this one, elevated levels can indicate stress, inflammation, or also impaired thyroid conversion. And then also there is the thyroid antibodies. So these help us diagnose autoimmune thyroid conditions like Hashimoto's and Graves' disease. So depending on the symptoms that you bring to your practitioner, they will be looking at some or all of these markers. So some of the things you can ask your provider is, am I getting a full thyroid panel or just a TSH? Is my thyroid function in the optimal range or within the conventional normal range? If my T3 is low, but my T4 is normal, what does that mean for my health? And let them explain that to you. And should I test for thyroid antibodies to rule out autoimmune thyroid disease? And all of these are really valuable because not only is it going to help you have a better understanding of where you are and what your numbers mean, but it also shows your provider that you're interested and you want to be an active participant in your care. And honestly, that's actually, from the provider perspective that sees, double digits worth of patients every day and you only get 15 minutes. When you actually come across a patient that is interested and wants to be an active participant in their own health, it's actually really refreshing. And I think you'll find that it can completely change that relationship with your provider in a good way. So the next little segment here that I wanted to touch on is metabolic health, blood sugar, and insulin resistance. Obviously, we know blood sugar imbalances can lead to diabetes, weight gain, fatigue, and inflammation. And conventional tests may catch diabetes, but functional medicine really focuses on early detection. So one of the things that is a staple is fasting glucose. And this is part of the CMP or the BMP that your physician will run in your annual exam. And again, this is a fasting. So that means you have not had anything to eat or drink other than water within the last 12 hours. And the conventional range of a fasting glucose that's accepted is anywhere from 70 to 99. But the optimal range really is 75 to 85. So if you're in that 85 to 99 space, then that might actually be showing some insulin resistance, some early insulin resistance that you'll want to catch early and start reversing. And so another marker that we look at is the HbA1c or the hemoglobin A1c. And this again shows average blood sugar over 3 months. And a result below 5.7% is considered normal, but the functional medicine range or number that we look for is less than 5.2%. And then something that functional medicine looks at that Western medicine doesn't normally look at is fasting insulin. And levels above 5 to 7 may indicate insulin resistance. So this is actually a really good marker to look at. And then there is also something called the HOMA-IR, HOMA-IR. It's a calculated score that evaluates insulin resistance before diabetes develops. So this one is really helpful too. So things that you can ask your provider if you're worried about insulin resistance or developing diabetes, or maybe you're already aware of some metabolic dysfunction that's going on. How do my blood sugar levels compare to optimal ranges? Do I show early signs and symptoms of insulin resistance? Can you help me tell me what those are and if I'm having those? Should I be monitoring my fasting insulin, not just my glucose? And if my HbA1c is borderline high, what lifestyle changes could I consider to implement? And I would also ask about dietary suggestions. Of course, I would keep in mind that most of our Western medicine dietary recommendations are governed by the ADA, which is the American Diabetic Association, or the American Heart Association. And unfortunately, all of these associations are deeply embedded with Big Pharma. And so I would venture to say that most of the dietary suggestions you're going to get from a Western medicine practitioner, they're probably okay, but they're most likely not the best. So I would also consider taking your results to a functional medicine practitioner and talking about, or even a holistic health coach, and talking to them about your numbers and about different dietary strategies and lifestyle strategies. And of course, I've had done tons of episodes on this too. So you can always go back into the archives of this show and find lots of helpful tidbits and resources. So the next aspect that you'll be wanting to monitor annually at minimum is the cholesterol and your cardiovascular risk. And we definitely want to look beyond the total cholesterol. Traditional cholesterol tests don't tell us the full story of our heart health, but functional medicine labs go deeper by evaluating inflammation and the actual cholesterol particle size, which is really going to give us a better idea of what is our true cardiovascular risk. So some key markers to test, of course, are the LDL and HDL. And the size and density of the LDL particles matter more than your total LDL. So keep that in mind. So your LDL might be higher than the standard guideline goal. However, we really need to know the size and density of that LDL particle to have a better and a truer picture. Triglycerides, obviously, functional medicine, we want to aim for a triglyceride number of less than 80. And then there's also something called the high sensitivity C-reactive protein, or the HSCRP. And this is a marker of inflammation linked to cardiovascular disease, and the optimum level is below 1. And then there's also the A-lipoprotein, and this will also give you, so this is where that LDL particle size comes into play. So the smaller, more dense LDL particles are more harmful than large, buoyant ones. So keep that in mind too. And so questions to ask your provider might be, do I need more detailed lipid testing beyond just the total cholesterol? The answer should always be yes. How do I, especially if you have a family history of cardiac dysfunction or heart attacks or any of those things, how do my triglyceride levels relate to my heart health? What's my HSCRP level, and does inflammation play a role in my risk? And should I be concerned about small, dense LDL particles? And if your provider gives you a funny look or like tilts his or her head to the side like a dog when you're, asking a dog a question, then it might be a sign in time to look for an alternative practitioner that is more familiar with some of these markers as well. And there are some fantastic cardiologists and GPs that are aware of these. So it's just a matter of finding those fantastic practitioners that are out there. And so the next thing that I think is really important is our nutrient status and checking for nutrient deficiencies. Many people have undiagnosed nutrient deficiencies that impact energy, immunity, and even mental clarity. And functional medicine nutrition testing provides these personalized insights for you. So, of course, I'm sure you've heard a lot about vitamin D, and the conventional range, again, pretty wide, 30 to 100. But the functional medicine range is 50 to 80. So if you are below 50, then you want to very much think about supplementing with vitamin D and or really starting to increase those foods that have vitamin D in them. So something else that we look at closely is vitamin B12 and folates, and these are essential for energy production, nerve health, DNA synthesis. If you are of childbearing age and you're wanting to get pregnant, then you definitely want to keep an eye on your vitamin B levels, especially the folate, because that is directly involved in the neural tube development of your baby. So, and though these are really easy to check, there's also the magnesium and zinc. These are important for muscle function, stress resilience, and immune support. And magnesium actually can also influence our sleep and our sleep quality. So it's important to have enough magnesium and zinc. And then the omega-3 index, which measures levels of the anti-inflammatory omega-3 fatty acids. And these have a strong impact on our brain health, as well as joint health and other things in our body. So, of course, these are the questions you want to ask your physician or your PCP. Are my vitamin and mineral levels optimal or just normal? If my vitamin D level is low, should I supplement or adjust my diet? And do I have signs and symptoms of B12 deficiency? And should I check for absorption issues? And then on to the last little segment here, which is, of course, my favorite. It's taking charge of your health. So we always want to be advocating for ourselves. So don't hesitate to ask for more comprehensive testing if you feel your concerns are not being addressed. And you also want to make sure that you're keeping track of your labs. So whether or not you download the results, or even if you have like a My Health Online or something similar to that, keep track of your past results and track the trends and the changes over time. Are you going in a good direction or a not so good direction? Don't ever be afraid to seek second opinions if you're not satisfied with your provider's assessment or their answers to some of the questions that I recommended. Then definitely look for a second opinion. Maybe look for a functional medicine practitioner, or again, some sort of integrative or naturopathic practitioner that would be more familiar with these optimal ranges versus just the conventional reference ranges. And then, of course, always be looking at lifestyle and nutritional adjustments. Your lab results can guide changes in diet, supplementation, and lifestyle to support optimal health. And as always, your healthcare journey should be personalized to you. You should be getting personalized health plans. Functional medicine uses lab data to create customized treatment plans tailored to your specific needs. And unfortunately, allopathic and Western medicine just doesn't do that. Like in general, you definitely might get some responses to if you have whatever labs are out of whack, but most likely it won't be personalized and specific to you. So if you need more guidance, partnering with a practitioner that's educated and trained in functional medicine, or again, some sort of integrative or naturopathic medicine, can really help you not only interpret your results, but help you and make informed health decisions that are really going to carry you forward and again bring homeostasis and balance back into your body and into your health. So understanding your labs is one of the most empowering things you can do for yourself and your health. And if this episode has resonated with you, please share it with a friend. Visit our website at drlaramay.com and explore how we can work together. And until next time, I encourage you to stay curious and take charge of your well-being. And again, always be advocating for yourself. Catch you in the next episode.